Fever, a word that sends chills down our spines, a universal sign of illness, a signal that our body is fighting something. It's our body's natural defense mechanism, a signal that something is amiss, a call to action for our immune system. But what happens when the cause of this fever remains a mystery, when all the usual suspects are ruled out? This is the perplexing realm of fever of unknown origin, or FUO. FUO is not just a fever, it's a medical enigma, a puzzle that challenges even the most seasoned doctors. Imagine a fever that persists for weeks, even months without a clear explanation. A fever that defies diagnosis. Standard tests yield no answers, leaving both the patient and the doctor in a state of uncertainty. Standard tests yield no answers, leaving both the patient and the doctor searching for answers. This is the frustrating reality of FUO, a condition that demands a systematic and comprehensive approach to unravel its secrets. This is the frustrating reality of FUO, a condition that demands a systematic and comprehensive approach to unravel its secrets. This essay delves into the world of FUO. We'll explore its definition, unravel its symptoms, and take a deep dive into its potential causes. This essay delves into the world of FUO. We'll explore its definition, unravel its symptoms, and take a deep dive into its potential causes. We'll journey through the step-by-step diagnostic process, shedding light on the tools and techniques used to uncover the source of this elusive fever. We'll journey through the step-by-step diagnostic process, shedding light on the tools and techniques used to uncover the source of this elusive fever. Finally, we'll discuss treatment strategies, emphasizing the importance of a multidisciplinary approach in managing this complex condition. Finally, we'll discuss treatment strategies, emphasizing the importance of a multidisciplinary approach in managing this complex condition. Emphasizing the importance of a multidisciplinary approach in managing this complex condition. FUO is more than just a high temperature. It's a constellation of symptoms that can be as varied as the potential causes themselves. Each case of FUO is unique, presenting a complex puzzle for medical professionals to solve. While fever is the hallmark, often exceeding 101 degrees Fahrenheit and persisting for more than 3 weeks, it's the accompanying symptoms that often provide crucial clues. These clues can sometimes be subtle, requiring a keen eye and thorough investigation. Imagine feeling the chills rack your body, followed by drenching sweats that leave you feeling drained and exhausted. This cycle can repeat multiple times a day, making it hard to find relief. This roller coaster of temperature fluctuations is a common experience for those grappling with FUO. The unpredictability of these symptoms can be particularly distressing, adding to the overall sense of discomfort. Add to that the persistent fatigue that makes even simple tasks feel insurmountable, and the picture becomes clearer. This fatigue can be so overwhelming that it affects every aspect of daily life, from work to personal relationships. But the symptoms don't stop there. They can extend beyond the physical, impacting mental and emotional well-being as well. Unexplained weight loss, often significant and alarming, can be a red flag. This weight loss can occur rapidly, leaving patients feeling weak and vulnerable. Loss of appetite, nausea, and vomiting can further complicate the picture, making it difficult to maintain a healthy nutritional intake. This can lead to a vicious cycle of malnutrition and further health complications. These symptoms, combined with the persistent fever, paint a picture of a body struggling against an unknown adversary. The challenge for doctors is to identify the underlying cause amidst this complex web of symptoms, requiring patience, expertise, and often a bit of detective work. The causes of FUO are as diverse as the patients it affects. It's like a medical mystery where the culprit could be hiding anywhere. To make sense of this complexity, we can categorize the causes into 4 main groups: infections, neoplasms, non-infectious inflammatory diseases, and miscellaneous causes. Infections are often the prime suspects in FUO cases. Think of common culprits like tuberculosis, a bacterial infection that can lurk in the lungs, or HIV, a viral infection that weakens the immune system. But the list doesn't end there. More unusual suspects include parasitic infections like malaria, often acquired during travel to tropical regions, or fungal infections like histoplasmosis, which can be found in soil contaminated with bird or bat droppings. These infections can be tricky to diagnose as they may not always present with typical symptoms. Section 3b, neoplasms, a silent growth. Neoplasms or tumors, both benign and malignant, can also be the hidden culprits behind FUO, or fever of unknown origin. Imagine a cancerous growth silently developing in the body, releasing substances that trigger the immune system and cause a persistent fever. These substances can create a complex interaction within the body, making it difficult to pinpoint the exact cause of the fever. Lymphomas, cancers that affect the lymphatic system, are known to cause FUO. The lymphatic system, which is crucial for immune function, can become compromised, leading to various symptoms including unexplained fevers. So can leukemias, cancers of the blood-forming cells in the bone marrow. These cancers disrupt the normal production of blood cells, leading to a range of symptoms, including persistent fevers. These cancers can be difficult to detect in their early stages, and FUO might be the first sign that something is wrong. Early detection and diagnosis are crucial for effective treatment and better patient outcomes. Section 3C, non-infectious inflammatory diseases, the body's own battle. Sometimes, the body turns against itself, leading to non-infectious inflammatory diseases that can cause FUO. These diseases are like a misdirected immune response where the body's defenses attack its own tissues. Rheumatoid arthritis, a chronic inflammatory disorder affecting the joints, and systemic lupus erythematosus, lupus, a disease that can affect multiple organs, are prime examples. These conditions can cause widespread inflammation, leading to persistent fevers and other debilitating symptoms. Section 3D, miscellaneous causes, a spectrum of possibilities. Finally, a myriad of miscellaneous causes can contribute to FUO. These can range from drug reactions where the body mounts an immune response to certain medications, to blood clots, which can cause inflammation and fever. Endocrine disorders, which affect hormone production, and hereditary diseases passed down through families, can also be the culprits. This diverse category highlights the complexity of FUO and the importance of a thorough investigation. Section 4, the Diagnostic Odyssey, a step-by-step guide. Diagnosing FUO is like piecing together a complex puzzle. It requires a systematic approach, starting with a thorough history and physical examination, followed by a battery of laboratory investigations and potentially culminating in advanced imaging and specialized tests. Section 4. The patient's story, a journey through time. The journey begins with the patient's story. A comprehensive history is crucial, delving into the patient's past medical history, travel history, medications, recent exposures, and any other relevant details. The duration and pattern of the fever are carefully noted, along with any accompanying symptoms. This detailed history provides valuable clues that can guide the diagnostic process. Section 4B, the physical examination. Clues from the body. Next, the doctor conducts a thorough physical examination, searching for any subtle signs that might point to the underlying cause. They examine the patient's skin for rashes, listen to their heart and lungs for abnormalities, and palpate their abdomen for any tenderness or organ enlargement. Every detail matters, as even the smallest clue can be significant. The findings from the physical examination, combined with the patient's history, help narrow down the potential causes. Section 4C, laboratory investigations, decoding the bloodwork laboratory. Investigations are the next step in the diagnostic odyssey. Blood tests are crucial, providing a window into the body's internal environment. A complete blood count, or CBC, can reveal signs of infection, inflammation, or anemia. Liver and kidney function tests assess the health of these vital organs, while inflammatory markers like erythrocyte sedimentation rate and C-reactive protein indicate the presence of inflammation. These tests provide valuable insights into the body's response to the underlying condition. Section 4D, advanced imaging, peering inside. If the initial investigations prove inconclusive, advanced imaging techniques may be employed to visualize the body's internal structures. Chest X-rays can detect lung infections or tumors. Ultrasound scans can examine the abdomen for organ enlargement or fluid collections. Computed tomography scans and magnetic resonance imaging provide even more detailed images, allowing doctors to visualize abnormalities that might be missed by other methods. Section 4E, specialized tests. Unmasking the culprit. In some cases, specialized tests may be necessary to pinpoint the elusive cause of FUO. Biopsies, where a small sample of tissue is removed and examined under a microscope, can be helpful in diagnosing infections, cancers, or inflammatory diseases. Bone marrow aspiration and biopsy, where a sample of bone marrow is extracted and analyzed, can diagnose blood disorders or cancers that affect the bone marrow. These specialized tests provide definitive answers when other methods fail to unravel the mystery.